My name's Himawan Fernando, and I'm a PhD fellow through the Alfred, Monash and Baker Institutes. The main health challenges that we looked to solve with this project was really finding ways of trying to improve outcomes for patients that have heart attacks. We know that remains a really concerning cause of death and disability in our community. So we were looking at ways that we could improve the therapy that we provide at the moment to try and improve outcomes in these patients. One of these aspects that we looked at was a recently described drug interaction between opioid painkillers that we use routinely, such as morphine, and a really critical blood thinner called ticagrelor that reduces the risk of death in patients that have had a heart attack. There have been reports overseas that studies have suggested that this combination may increase the risk of death and repeat heart attacks. And therefore, we were really interested in looking at alternative painkillers to opioids that we might be able to use in patients that have had a heart attack, really until we wait for further studies to see whether this interaction is really significant or not. So our study looked at an agent called lignocaine, which is a non-opioid painkiller. It's been used for pain relief in other settings, including at the Alfred, for example, in acute burns, and it's been used in the trauma setting. So we were really looking to apply this to the cardiovascular setting to see if we could use this as an opioid alternative for patients that were suffering heart attacks. So this project really involved a strong collaboration between Monash University, the Baker Institute, the Alfred and Ambulance Victoria. And in this project, we had Ambulance Victoria paramedics recruiting patients in the community that had a suspected heart attack. And this was a randomized controlled trial, so a clinical trial, where we gave patients either intravenous lignocaine or intravenous fentanyl, which is an opioid. So patients that were recruited were randomized, so they had a 50-50 chance of having one or the other agent. And this is really the strongest type of study that we have to try and determine whether intravenous lignocaine is a safe and effective alternative to opioids like fentanyl. So for this trial, the main endpoints that we were looking at was pain reduction in the ambulance on the way to hospital, and also side effects related to both drugs. But then we also looked at blood tests that give us a sense of heart muscle damage from the heart attack. And we had a proportion of patients in the trial that had heart MRIs, again to assess heart muscle damage. And then finally, we looked at the proportion of patients that had a repeat heart attack within 30 days from enrollment in the study. The main outcome that we found was that lignocaine was not quite as effective as fentanyl in our trial. So on the 11-point pain scale, lignocaine reduced pain scores by about 3 points and fentanyl by 4. But what we did find was that lignocaine was very well tolerated in this context, and it's never been used in this setting before. And also that it was had less side effects than fentanyl. So we found much less nausea and vomiting in patients that were given lignocaine compared to fentanyl. We found no differences in terms of blood tests looking at heart muscle damage or in the heart MRIs between the two groups. But we think that this is a really promising first study to show that, yes, it is feasible to give lignocaine in the ambulance for patients that are suffering a heart attack. Whilst it may not be quite as effective, it still had a pretty significant reduction in pain and was well tolerated and safe. The hope is that if we can find that using lignocaine or even IV paracetamol that has been trialled overseas for chest pain related to heart attacks, if we can show that improves outcomes for patients after a heart attack, either by reducing the risk of a further heart attack or reducing the amount of heart muscle damage, it could change the way we manage pain in heart attacks in the future, both in Australia but also internationally.